Hello, YouTube. It's been a while, like a few years, and I wanted to give you guys an update on my life and what has been going on and why I've been so busy, etc., etc. Since I last posted a video back when I was in private practice, right out of residency, I have joined an academic institution and I'm now an assistant professor there, and I have been teaching medical students. I have been involved in clinical care with OMT, acupuncture, injections, and it's been amazing. So I wanted to fill you in on things. I mean, I had a baby a year ago. I'm in my house, which I purchased. I have a dog now. There's a lot of crazy stuff that's happened. And forgive me too if I'm nasally. These allergies. Um, But I just wanted to touch base because I've been getting a lot of questions, students reaching out to me about profession. So today I wanted to talk about OMM residency. I did a 3-year OMM residency. Some people are like, you can do that? Yes, you can. And there's many different types, so we'll talk about the types. I'm now a residency program director, specifically of the ONMM3 program, which is a 1-year residency. The other options are ONMM2, which is what I did. You do a transitional trip followed by 2 years dedicated OMM residency. And then the ONMM3 is a full 3-year program with internship, 2 dedicated years of OMM. So you might think to yourself, well, why would I want to do an OMM residency? And for me, the reason was I really wanted to master OMM or osteopathy. It is a guiding foundational principle within my practice of medicine. I use it not only to diagnose, but to treat, to figure things out where a patient needs help. It builds a strong foundation too for my acupuncture practice, because you really have to know and dial in your anatomy. So, that being said, students are like, well, why not PM&R? Why not sports medicine? Why not do that? Well, I just followed my passion, right? My passion was OMM, so I followed it. Here we are. If your passion is sports medicine and you still want to use OMM, that's amazing. You can. I quite interested in doing primary care or inpatient medicine or working in I tried private practice. It wasn't quite for me, but I really love teaching, so I went academic, which is a majority of where OMM physicians end up going towards because it is such demand. To give you a perspective, when I graduated residency, I was about one of 21 OMM residents in the country, and as of this most recent year, it's about 96. Amazing. It's growing. About 1 in 4 medical students are DO students. So it is becoming more known because all DO students have training in OMT and OMM. And they're wondering, okay, where do I send my patients who need OMT? Well, they probably try to find an OMM specialist or someone who does this all day, every day. That's who I wanted to be. So first ask yourself, when picking a specialty or residency, ask yourself, okay, do I want to be inpatient, outpatient, surgical, non-surgical? Do I want to be at an academic institution, a private institution, a group practice? Where do I see myself practicing? And you want to ask yourself about your lifestyle. Do I want a family? Do I want to have time on the weekends? Do I want to be on call? Do I not want to be on call? And think about the end goal. That's how you determine the steps to get there. And when you go through this thought process, really try to listen to yourself and your gut and your heart about what you want in life. You're going to be spending just as much time at work as you will in a lot of cases with your family, with your loved ones. So you better love what you do and who you work with, because that is a large part of your life. So when I was thinking about, oh, what do I want to do? Initially I was orthopedic surgery, then I thought podiatry, then I thought, you know what? I love OMM. That's all I want to do. I want to be a master of it. Let's go. All out. Um, yes, it is a very stable, stress-free, for me, career. And I don't regret it even a little bit. I am so thankful that I followed my path and got, I guess, to my end goal, right? Working as an attending, teaching residents, students, making an impact, having a lot of fulfillment in my job, especially in an age where people, medical field are starting to feel burnt out, scared about AI taking their jobs. I'm certainly not worried about AI, at least taking my job, because it's literally all manual, very humanistic, person-to-person contact. We are already seeing things like radiology being affected by AI, right? Like a lot of these reads are being performed by AI, going back to the radiologist for confirmation, things like that. So think about that. Think about future implications of your profession, of specialty, and what does that hold for you? Maybe you're going to be really involved with AI and managing it and teaching others how to use it. But anyways, that's a little bit about how to pick your specialty. And in terms of what you learn in OMM residency, this is a good question I received of, well, how is it actually different? Sports medicine, podiatry. Well, it's all about the emphasis. You're going to see the same cases, but with an OMM background, residency training, a different lens. You're going to first think, okay, how can OMT play a role? How can my hands properly diagnose what's going on? A lot of my patients have been improperly diagnosed because they haven't been palpated to such a depth that I can provide. So they come to see me and I make different judgment calls based on what I'm feeling with my hands, not what tests am I looking at or labs, etc. And that can play a significant role in altering their care, hopefully for the better. But it can also help me determine, okay, is what I do going to be enough? Maybe they need to have injections. Maybe they need to go and talk to a surgeon. A lot of times as well, patients come to me after getting surgery. Honestly, like a third of my cases the other day. Post-op, because there was no other place for them to go, and they were in a lot of pain. So, yes, I will be seeing them probably forever, but hey, they're not taking medications for their pain. They're seeing me once a month and getting relief that they can live their lives with. So that's kind of what I would say the main difference is. You're going to be seeing the same population as PM&R, sports med, but you're also capable of treating a lot more things, such as infants, post-op cases that have kind of hit the end of their road with their care, and then they see you and they're like, whoa, I didn't know this was possible. And I think that's super valuable and underprovided current medical. So that's my why. That's why I went into osteopathic medicine residency, osteopathic neuromusculoskeletal medicine residency. ONMM is the technical term. Yes, after ONMM residency, you can go into sports medicine. You can go into pain medicine. There's a lot of different fellowships available. I just did my acupuncture fellowship during residency, which is an option, but not many people do it or know about it, but that's what I did. It was awesome because when I got out of residency, I hit the ground running. I just started private practice for almost a year. So determine what your end goal is. Path to get there could be very different depending on the person. I would just say stay true to yourself, your goals, what fulfills you as a provider. I work in a group academic practice setting. We have for 10 providers providing from physiatry care to addiction and pain medicine to OMT, acupuncture, and we are heavily integrated with spinal surgeons in our network, physical therapy, neurology, what have you, all these other specialties to provide the best care possible. So living the dream here, and if I can help you achieve that, drop a question in the comments, drop a comment in the comments, anything you want to ask, I'll get to it. And if I helped you think about things, figure things out, that's great. Like, subscribe, hit the notification bell, whatever you want to do. I'm not really trying to explode my YouTube. This is literally just because I get so many questions, and I'm like, you know what? It's quiet in the house. Wife's asleep, baby's asleep. Let's record a little something for the people. Let's put it out there and see what happens. So, thanks for watching this little baby pod.